Hi there, welcome to our video on valvular disease. Today we will be focusing on stenosis and regurgitation. In stenosis, there is narrowing of the heart valves. This leads to the failure of these valves to open sufficiently, causing a decreased forward flow of blood. Okay, let's look at a quick example. In the diagram, you can see the mitral valve has become narrow. This means that the blood from the left atrium is no longer pumped out sufficiently into the left ventricle. As a result, there's an overload of pressure in the left atrium. Also note, the left atrium is going to have to work harder to pump blood through the mitral valve into the left ventricle. This will result in left atrium hypertrophy. It's caused by congenital heart disease, calcium deposition with old age, and rheumatic fever. Rheumatic fever is caused by a group A streptococcal infection. While our body is trying to fight off this infection, our immune cells mistake some of our host tissue for the infective organism, and the immune cells then cause damage to these host tissues. This process is known as molecular mimicry. The heart is one of these host tissues targeted by the group A infection. With recurrent infections, there is damage to the heart valves, and this leads to stenosis or regurgitation. When we look at regurgitation, the valves fail to close properly, and this leads to increased backflow of blood. Let's look at a quick example. In the diagram, you can see the mitral valve doesn't close properly, so when the left ventricle contracts, blood from the left ventricle leaks back into the left atrium. This causes volume overload in the left atrium and can cause hypertrophy. Regurgitation is caused by hypertension, dilated cardiomyopathy, and rheumatic fever. It's important to remember that valvular disease increases the risk of developing infective endocarditis. Infective endocarditis is the infection of the endocardium by microbes forming bulky vegetations. Clinical signs of infective endocarditis include a murmur, which indicates the underlying valvular disease, fever, splinter hemorrhages, and Osler's nodes. And that concludes this video on valvular disease. Thank you so much for watching. We really hope it helped. Don't forget to do the quiz on the heart pathologies. The link will be in the description below.